the abortion pill the deadliest weapon of our times? Or is it safer than paracetamol? Could an abortion be as simple as popping a pill for a headache? The US Supreme Court made headlines for temporarily allowing the use of Mifepristone despite a lower court's ruling to severely restrict access to the drug over safety concerns. However, during a recent hearing, two pro-life female gynecologists spoke out about the dangers of the abortion pill and how chemical abortions are not safer than paracetamol. But is it the truth? Let's find out. Before we do that though, make sure that you like this video, subscribe to this channel if you haven't already, and hit the notification bell so that you don't miss any of our videos. Alright, so Dr. Ingrid Skop, Vice President and Director of Medical Affairs of Charlotte-Lozier Institute, during a recent hearing of the US Senate Committee on the Judiciary regarding the abortion pill ruling, spoke about the harmful effects of chemical abortion. Let's hear what she has to say.
Regarding chemical abortion, the industry tells us it's safer than Tylenol. They're comparing Tylenol overdose deaths to the undercounted deaths from chemical abortion. There's no comparison. Women assume they mean normal Tylenol use. They don't realize that they're comparing it to deaths that happen from overdoses. The abortion industry tells us about the complications they know about, but my experience has been, because the women have been assured it is so safe, when they have a complication, they do not return to the abortion provider. They come to me as their gynecologist, or they come to the emergency room in distress. And so when we look at good quality records linkage studies that detect all chemical abortions and all subsequent events, we find 5 to 6% of these women present to an emergency room within a month. Approximately the same number will require surgery because their bodies cannot evacuate all of the dead tissue. And I am still caring for these complications in Texas, even though we've had abortion limitations for quite some time, because these drugs are circulating in the state to try to circumvent our state laws and provide abortions to these unfortunate women.
All right. So I completely agree with Dr. Ingrid, and it's sad to see so many women have been convinced by the abortion industry that Mifepristone, which is one part of the abortion pill combo, is a safe and easy alternative to surgical abortions. Right now, it is used in approximately 94 countries to perform medical abortions. The abortion industry gives you a pretty picture. Don't want to have a baby? Oh, just take a pill and it will go away. You'll just have a few minor side effects which are just, like your monthly period. And then a few days later, it's all done. Quick, simple, and effective. But is it really? What really happens when you take an abortion pill? Well, let's watch this video from liveaction.org to really understand how the abortion pill works.
My name is Dr. Noreen Johnson. I'm a board-certified obstetrician gynecologist with 44 years of experience, and I've completed over 1,000 abortions. The abortion pill regimen consists of 2 steps. Step 1. At the abortion facility or at home, the woman swallows Mifepristone pills. Mifepristone blocks the action of a hormone called progesterone. Progesterone is naturally produced in the mother's body to stabilize the lining of the uterus. When Mifepristone blocks progesterone, the lining of the mother's uterus breaks down, cutting off oxygen and vital nutrients to the embryo, who then dies inside the mother's womb. It is important to note that even after it has been taken, it is possible to stop the effects of the Mifepristone and save the embryo if progesterone is administered. If the woman wants to stop the effects of the Mifepristone, she needs progesterone as soon as possible. Step 2. 24 to 48 hours after taking Mifepristone, the woman takes Misoprostol by placing the pills in her cheeks. She will experience severe cramping, contractions, and heavy bleeding to force the dead embryo out of her uterus. The process can be very intense and painful, and the bleeding contractions can last from a few hours to several days. While she could lose her embryo anytime and anywhere during the process, the woman will often sit on a toilet as she prepares to expel the embryo, which she will then flush. She may even see the expelled embryo within the pregnancy sac. After she has disposed of the embryo, The woman may have bleeding and spotting for several weeks. Bleeding lasts on average 9 to 16 days. 8% of women bleed more than 30 days, and 0.5% require hospitalization because of heavy bleeding. The failure rate increases as the pregnancy progresses. At 8 weeks or less, the failure rate is 2 to 6%. At 8 or 9 weeks, the failure rate is 4 to 6%. At 9 to 10 weeks, the failure rate is 7 to 9%. At 10 to 11 weeks, the failure rate is 13%. If failure occurs, she will usually be offered a surgical abortion in which the embryo or remaining tissue is removed using suction. For the mother, abortion pills often cause abdominal pain, nausea, vomiting, diarrhea, headache, and heavy bleeding. Maternal deaths have occurred, most frequently due to infection and undiagnosed ectopic pregnancy.
Well, in the last few decades, access to abortion has been viewed as a marker of progress for women's reproductive rights and gender equality. Critics argue drugs like Mifepristone are essentially healthcare. However, healthcare by definition is the various services provided for treatment or prevention of illness and injuries. In an abortion, the unborn child is killed. Women who take the abortion pill are not free from injury too. They suffer from emotional and serious physical consequences. If so, how can medical abortions be classified as healthcare? It just doesn't make sense. So, what do you think about this? Do you think abortion pills are harmless and should be promoted as healthcare solution? Or is it dangerous, causing harm to both mother and the child? Let us know in the comments below. And if you like this new format, let us know by liking and subscribing to our channel. Until next time.